We're here today to talk about quality improvement in terms of the Reducing Restrictive Practice programme. So that programme is part of the National Mental Health Safety Improvement Programme, and that's led by NHS England and NHS Improvement, where they were encouraging trusts to become part of a wider collaborative across the country and really offer some bespoke coaching and a programme, a community of practice improvers really, to try and tackle the issue of restrictive practice. And you might ask, what is quality improvement? And quite simply, it's a particular process which you can follow to make things better. Its aim is to make things better for patients, for carers, to improve our services, but it also helps our staff to become more empowered to make a difference and make a change in their workplace. So Kennet Ward in particular chose to look at seclusion and the use of seclusion within their environment. And how we did that with Kennet Ward was members of my team trained Kennet Ward staff in QI methodology so they could understand the process and use it in practice. We also had support from our AHSN colleagues. So between AHSN and OHI, my team, we coached Kennet Ward through their project. It was their project, they held it, they ran it, we were just there to provide some extra support and expertise to help them understand their data and plan their interventions.
The first approach the trusts take regarding quality improvement is to empower staff all over the trust. So there were regular drop-in sessions for quality improvement, there were trainings that are delivered for all members of staff that are interested in quality improvement projects. And then the staff has been supporting loads of departments with their QI projects as well. So they do get the support via the QI Hub as well. So there are lots of trainings available from level 1 to level 3 for QI improvements. So this really empowers staff all over the trusts.
We kind of had to do a lot of communication, discussions, testing things out, doing some audits, and bringing as many people on board in terms of staff, patients, and making sure that people were okay with this and subscribed to it and could see the benefits. That has got us into the process of thinking, looking, questioning, researching, getting some evidence-based practice, looking at things that have been done well elsewhere.
Our biggest achievement was to bring everyone on board and start what we called an MDT review, especially before the weekends, before the bank holidays. I do seclusion auditing, which then I present in the safe and positive meetings every 2 weeks. We discuss about it. And one of the main questions in those audits is about looking at the rationale of secluding somebody. On every review, the moment you introduce a quality improvement project, there's like you see things differently. So I would recommend that because this has put Kennet Ward from one place to another.
So since we implemented the QI on the ward, there's been a lot of change in terms of the patient dynamics and how we are running, the ward is running. So since we started looking at a patient in a holistic manner as an individual and looking at their own needs, what they needed, I think it has helped as well, and they kind of engaging into their care as well. I know there's an improvement because we haven't had seclusion for quite a while. So I would say there's improvement.
I can never emphasize the need for communication enough. So it was communication every day, every shift. That's what got us to where we are today.
Staff are proud of their achievements because they've achieved a lot over the last few months.
I think something important to take home about quality improvement is that it doesn't just end. You don't do a project and it finishes and then you revert back to your previous practice. Whatever you achieved, you need to embed in your practice, and it just becomes business as usual. Your improvements shape the way that your service develops and the way you care and treat our patients as well.
So I will really recommend a project, a QI project across the whole globe, really, because it's the way to go nowadays, especially when you are working in places like our places where people come in with all sorts of traumas. Even staff, they've got their own traumas, how we can work together to produce something positive. I think that can only be done through a quality improvement project.